tonight's program. My organization is called African Immigrants Dream. It's a 501c nonprofit organization, and our mission is to support and empower low-income families and immigrants, specifically African immigrants, to pursue our dreams in the United States. We do so through educational programs, resource navigation, and advocacy. And our two main programs are on career professional assimilation, health education, health promotion programs. We have picked on health education because we know our health and the health of our loved ones greatly impact our dreams. If you have a family member that's sick and you have a dream, it's very hard for you to pursue your dream because you have to stop whatever you are doing to take care of your family member. So health is very important. And tonight, before we start our actual presentation, I would like you to visit our website. It's www.myafridreams.org and check on our upcoming programs. And I'll also invite you to donate so we can continue to offer free programs like this. Our speaker is doing, this is an in-kind donation for us. But in the future, you know, I think we will have to kind of support our speakers that will be joining us. So we are asking all of you to go to our website and donate to us. Our upcoming program will be in April 15th, and it's going to be on back injuries because we have noticed a lot of our Africans are having back injuries from their work. So there will be an educational program on that on April 15th, 7 p.m. to 8 p.m. Tonight, I am pleased to introduce Dr. Frank Odame. Dr. Frank is a dedicated and experienced pharmacist with a PhD degree. Dr. Odame has been serving our community as a healthcare professional at CVS for over 13 years. He has a wealth of knowledge in medication management and patient care. Dr. Odame has been instrumental in helping patients achieve better health outcomes through personalized and compassionate services. We are lucky to have Dr. Odame here. And tonight, our topic for discussion is a very, very sensitive topic. And we all know erectile dysfunction is something that's very hard for us to talk about, especially as Africans. And we are here this evening to break the silence. We want everybody to be part of this discussion, to put their questions in the chat. And then we want to talk about this issue. It's a very sensitive issue, but we have to break the silence. So please join me in welcoming Dr. Frank Odame. Thank you, Dr. Odame, for being here. And we are ready.
Hi, yes. Thank you, Auntie B. Thank you for the introduction. And thanks to everyone who made it here. Today, like Auntie B said, we are going to talk about erectile dysfunction. This is a topic that many people don't want to talk about. Hi, I will encourage everyone to mute their microphone. Okay, so this is a very sensitive topic in many cultures. Nobody want to talk about. Men who experience this problem, you know, usually see it as loss of masculinity. They see it as not being a man enough. Because of that, they don't want to discuss it with anybody and they don't want to talk about it. And in many cultures, especially our Ghanaian culture, discussing sexual health can be very embarrassing it is seen as inappropriate. And there's always stigmatization for people who have erectile dysfunction. And because of that, people keep it to themselves. They don't seek medical advice. But then today, we are going to talk about it. And then we are going to let everybody know that this is also another form of medical condition that need to be discussed with your doctor. Erectile dysfunction is a consistent inability to achieve and maintain erection that is sufficient enough for sexual performance. So this is not like a one-time thing. This is something that can be like an ongoing thing. Every time during sexual activity, you are not able to achieve and maintain an erection. It is common for any man to have erectile dysfunction. It can happen. But then if it becomes like a problem, if it becomes like a repeating thing, then you need to seek medical attention. This problem can affect men of all ages. As a matter of fact, 50% of men between the ages of 40 and 70 all experience this type of problem. And in the United States currently, about 30 million people have this form of problem. You see, this picture tells it all. It can be a problem in relationship. So we need to discuss it. We need to have an open communication about it because it's affecting families. Okay, let's see the anatomy of the penis. This is a cross section of the penis. You see, it has different chambers. This chamber is called corpus cavernosum. Corpus cavernosum. It's like a sponge. It has many holes in it, many blood vessels. So when the penis is not erected, it is soft because the holes in it make it soft. But during sexual arousal, the brain releases a hormone called nitric oxide. This nitric oxide dilates, it opens these blood vessels in the penis, and once they are open, they are able to have blood in it. You know, blood is able to transfer to fill these small holes in the penis. And once they are filled with blood, they become hard, they become erected. So, I mean, look at it like water hose, you know, that is used to water our gardens. When it is flat, when it doesn't have water in it, it is soft, you know, it is soft. But once you turn on the water and then it fills the holes, it becomes hard. So that is how the erection happens. Once the blood vessels in the penis get filled with blood, it becomes hard, and then it gets erected. There are different types of erectile dysfunction. We have vascular erectile dysfunction. This is common. This is the most common one, and then it affects the blood vessel that send blood to our penis. And then we also have the neurogenic erectile dysfunction. It occurs when there is damage to our nerves. The nerves that send message from the brain to the penis has a problem, and it's not because of that, the brain is not able to communicate with the penis. So sexual activities can be going on, but then the penis will not understand. It will not get erected because the communication between the brain and then the penis get affected. We also have hormonal erectile dysfunction. I don't know if many of you have heard of low T, low testosterone. Most of the time they call it low T. If you have low testosterone, it can also affect your erection. And then we have psychogenic erectile dysfunction. This is the condition that affects your talk, your feeling. You know, if you're having depression, anxiety, it can affect your erection. So a lot of the time, this erectile dysfunction doesn't happen alone. There are always underlying conditions. Somebody might be walking around, they don't know that they have, especially people that don't visit their doctors, people that don't go to the hospital. You can be complaining of erectile dysfunction and not knowing that your erectile dysfunction is caused by something, a medical condition that is happening to you. You might be having like a diabetes, you don't know, and then you'll be taking medication to treat erectile dysfunction. Meanwhile, you don't know that you have to treat your diabetes because
recording in progress.
These are caused by cardiovascular problems, they are caused by diabetes and high blood pressure. So, yeah, like I was saying, we have multiple causes: cardiovascular disease, hypertension. If you have hypertension, it can affect blood flow to the penis. If you have blocked arteries, if the arteries that supply blood to the penis is blocked, it can affect your erection. And also diabetes. People that have uncontrolled diabetes, the underlying word is uncontrolled. If you have diabetes and you are not taking medication to treat it, if you are not eating healthy, you are not exercising, it can affect your erection. Currently, about 70% of men who have uncontrolled diabetes have some form of erectile dysfunction. So taking care of our diet, watching our portion size is very important. Obesity and poor diet. Excess weight can cause hormonal imbalances. So when you have weight, you have to make sure you lose weight because it can affect your erection. Hormonal issue, like I've already said, low testosterone can also cause erectile dysfunction. If you have low testosterone, you have decreased libido and you lose stamina as well. So it can affect your erectile function. Neurological condition. Somebody who has had a trauma, stroke and some form of injury, it can also affect your erection. Medical, some medications like antihypertensive, antidepressant, some of them, they have a side effect of, it can affect your erection. The side effect can affect your erection. That doesn't mean that if you have this condition, you are not going to take the medication. Taking medication to treat hypertension is very important. It's very important. So if you think that your medication, before you were taking your medication, you were fine, your erection was fine, and then after taking the medication, if it's having effect on your erection, you have to discuss with your doctor to either change the medication for you or give you something to treat your erectile dysfunction. Stress and anxiety can also cause erectile dysfunction. Your feeling play a role in getting and maintaining erection. So feeling relaxed and confident is very essential for erection. So if during sexual activity you are thinking about something, you are not focusing, if let's say you're having financial problems, you're thinking about all these things, it can affect your erection. Like somebody, like I said earlier on, Having erectile dysfunction one time or two is very common in men. But then, if you think about your previous erectile dysfunction, sometimes people think about it and then they think that it's going to happen again, you know? So that anxiety can make it happen and then it become a repeated thing. So stress, anxiety, depression can all cause erectile dysfunction. Relationship problems. If there is a problem in the relationship, you have to have open communication about it and then resolve your conflict. Unresolved conflict can also cause erectile dysfunction, especially here in this country. Many couples always talking about financial issues, you know, they talking about their project they're doing in Ghana and all that. All these conflicts can affect intimacy. It can affect your relationship, and then it can cause the man to have erectile dysfunction. Smoking and alcohol. I mean, the rule of thumb is that whatever is not good for your heart is also not good for your penis. You know, so smoking is not good for your heart. Smoking is not good for your penis. People that smoke can have erectile dysfunction. People that drink can have erectile dysfunction. So if you want to address your erectile dysfunction and you smoke, you have to quit smoking. You have to quit alcohol intake. Sedentary lifestyle, not having physical activity can also cause erectile dysfunction. So if you're a man, you have to take your physical activity seriously to prevent erectile dysfunction. Taboos and stigma around discussing sexual health. You know, men don't want to talk about erectile dysfunction, you know, and they say that if you don't if you don't let people know your disease, it's hard to get treatment for it. Over-reliance on herbal medication. You know, some people constantly take herbal medication to treat erectile dysfunction. I mean, if there are a lot of people take some alcoholic beverages, you know, they take it regularly to treat erectile dysfunction. When you rely on these medications for a long time, it can affect your erection and it's not good. So diagnosis. Now that we know multiple causes of erectile dysfunction, your doctor during assessment will assess your medical history. Your doctor will assess the medication, will review the medications you are taking. Sometimes they will ask you so many questions. They will even involve your partner. They will ask your partner questions. It can be embarrassing sometimes, but it is normal. But what we should understand is that this problem, you are not in it alone. It can happen to every man. It will surprise you that your doctor is also having the same problem. So don't feel shy discussing this with your doctor. So what are the treatments for erectile dysfunction? Okay, we have medications, approved medication, evidence-based medication that are used to treat erectile dysfunction. So discuss it with your doctor. We have this medication we call phosphodiesterase 5 inhibitors, the Viagra, Cialis, Levitra, these medications, these popular medications, what they do is that the blood vessel that supplies blood to the penis, they open these blood vessels, they dilate them so that blood is able to flow freely to the penis. So these are the approved medications to treat erectile dysfunction. But we have to be cautious here. If you are taking medication for chest pain like nitrate, medication that treat heart condition, these are contraindicated. You cannot take these medications if you take nitrate, because these nitrate, they have similar effect as the phosphodiesterase inhibitors. So when you are taking nitrate to treat chest pain, you cannot take these phosphodiesterase inhibitors, these Viagra, Cialis, and Levitra. You cannot take them. So Viagra, it takes about 30 minutes to an hour to work. So you take it before 30 minutes to an hour before sexual activity. So before you have sexual activity, you take it, and then it can last in your system for about 6 hours. Cialis, which is called tadalafil, that one also takes about 30 minutes to onset, 30 minutes to start working. So you take it like 30 minutes before sexual activity, and then it can last in your system for about 36 hours. Because of that, it is called the weekend pill, because it has a long half-life. It can stay in your system for long. So usually, when people take it in the weekend, it can last you for the whole weekend. Levitra also works similarly as Viagra. It can last for about 6 hours, and it takes about 60 minutes to work. So these pills are the first-line treatment for erectile dysfunction. For people that these medications don't work for them, we have injections that you inject directly to the penis, and these injections work so great. In fact, it has about 95%, about 85% efficiency. So they work so great, you inject it to the penis. And then we also have suppositories, suppositories that you insert into the urethra, the hole in the penis, you insert them into the holes of the penis. So people that cannot take the pills, people who are on nitrate, and then they cannot take the tablet, they can use the injection. So one of the differences between the injection and then the tablet is that with the injections, they work right away. You don't need to be aroused for the medicine to work. Once you inject it, 5 minutes to about 15 minutes, it starts to work. You start getting erection. Even if sexual activity doesn't start, you will still get erection, because this is injected directly into the penis, and then you get the injection right away. Unlike the tablet, you have to be aroused. You have to, go through this sexual activity to get erection. This one, the erection will happen no matter what, even if the sexual activity doesn't happen. Yeah, so it's highly effective, and it lasts for about 60 minutes. Yeah, so the suppository too, like I said, you inject it into the urethra, and then it takes about 30 minutes to start working, and it also lasts for about an hour. Yeah, so these are the differences I was talking about. With the pills, the phosphodiesterase 5 inhibitors, they dilate the blood vessel. They dilate the blood vessel for blood to go through the penis. It takes about 60 minutes to start working, versus the injection takes about 15 minutes before it starts working. The tablet, you need to be aroused for it to work. The injection, it doesn't need arousal. It just starts working right away. Common side effects for the tablet are headache, and then flushing. Flushing is when you feel like warm, and sometimes you see redness in your skin. You can be dizzy. I mean, this is not to say that if you take the medication, you are going to get these side effects no matter what. No, these are, some people can experience headache after taking the medication. Some people might not experience anything. It works fine. These medications work fine in most people. The injection for people who have needle phobia, who are scared of needles, it can be a problem. And then it can also be pain at the injection site. And there is this thing called priapism. Because this one you inject it directly into the penis, and the erection will happen no matter what. Some people can experience priapism. Priapism is when you have long erection, even after the sexual activity, you still have erection, so priapism can occur. Men with low testosterone, these men can have testosterone replacement therapy. This therapy comes in gel form, it comes in injection form. If you see the picture, the gentleman is injecting himself with testosterone. So for men with low testosterone, if your doctor determines that your erectile dysfunction is as a result of having a low testosterone, he will give you a testosterone therapy, and then you can inject, or you can rub it on your skin, or it has a patch that you can also attach to your skin. For people who don't like to take medication to treat that dysfunction, there is this vacuum pump. It works so great. In fact, it works so great. So what it does is that it's a cylinder. It's a cylinder. So you put your penis in the cylinder, like what this picture is showing. You put your penis in the cylinder, and then the pump here, you pump it, you pump this one, and then it draws air out of the cylinder. By drawing the air out of the cylinder, it's drawing blood into the penis. So blood gets filled in the penis, and then you get the erection. So once you get the erection, to maintain the erection for sexual activity, you attach this ring to the base of your penis, so that to hold the blood in your penis and then maintain the erection. This thing works so great. In fact, it works so great. So for men who don't like taking medication, you can consider this vacuum pump. Okay, so if everything fails, if the medication doesn't work for you, if the injection doesn't work for you, if the vacuum pump doesn't work for you, then you go for a surgery. There is a penile surgery. It's a penile implant where the doctor put a cylinder, this cylinder in your penis. It's a cylinder, but then it's not something somebody can see. If you take off your clothes, nobody will see because it is inside your body. They put this cylinder in your penis, and then there's a reservoir here. This reservoir is filled with normal saline, and then they put a pump in your scrotum, this pump here. So now you have control over your erection during sexual activity. I mean, your partner cannot see it. If you want to have an open discussion with your partner about it, it's great. But if you don't want your partner to see it, they won't see it. During sexual activity, you press this pump in your scrotum, and then the normal saline release from here, and then fill this cylinder. Fill this cylinder. So once this cylinder is filled, you get the erection. You get the erection. So now It's like you have a control over your erection. You control it. You have control over it. So it's like you turning on light. You press the button and then the light is on. If after sexual activity, you want to lose the erection, you want to go back to the flaccid state, you press the pump again, and then the normal saline go back to the reservoir, and then you lose the erection. It works so fine. It works so fine. It's a surgery, and it's usually good for 15 to 20 years. After that, you can still go back and have the surgery. You can still go back and have the surgery. It works. It works so great. It works so great. But then the only downside is that it's not reversible. It's not reversible. So if after some time you want to go back to your normal thing, you don't want this thing again, you cannot go back. So once you have it, it stays with you for life. There are other non-pharmacological ways of helping with your erection. You have to adapt to a healthy diet. A diet rich in fruit, vegetables, and lean protein. So food like watermelon, spinach, and nuts, they improve blood circulation. They help improve blood circulation. So you can include this food in your diet: watermelon, spinach, and then nuts. Regular physical activity is also good. It helps with blood flow. When you do exercises, it helps with your blood flow, and then it's also have cardiovascular health. Loss of weight. Losing weight is very important. Losing weight helps you build stamina, and it helps control erectile dysfunction. So couples can also seek counseling. Seek counseling. If it becomes difficult, you can seek counseling. And there are also some herbal medications that can help: your himbi, ginseng, and then mega root. For people who like, herbal medications, these are okay. But the problem is that you don't want to over-rely on herbal medications because we don't know much about them. We don't know much about the side effect. Sometimes we don't even know how they interact with the medications you are taking. Okay, now let's talk a little bit about premature ejaculation. Premature ejaculation. So some men can have erection. They can have erection fine, but then they ejaculate easily. Some, they even ejaculate before the sexual activity, and some, they ejaculate like as soon as the sexual activity starts, less than 2 minutes, they are already there, This can be a problem, especially for the woman, because the man will enjoy the pleasure, all right, the pleasure that comes with the sexual activity, all right, but the woman will not. And most of the time, women will call these men as being selfish because it's a mutual thing. You are enjoying it, they are not enjoying it. So it's a problem, and we need to also talk about that. So how do we treat this problem? Phosphodiesterase 5 inhibitors again, the Viagra, the Cialis, the Levitra, they help maintain erection. So your doctor can give you this medication. For people who don't want to take medication, there is this technique called start and stop method. Start and stop method. So you pause the stimulation during sexual activity. You can pause the stimulation. The stimulation is the going in and coming out of the vagina. So you can pause it. You can pause the stimulation and wait for a little while before you begin the stimulation. So when you feel the urge to ejaculate, you pause it, and then when the urge subsides, you begin to do the stimulation again. There's also this squeeze technique. The squeeze technique is when you feel the urge to ejaculate, you remove the penis and then you hold the tip. You press and squeeze the tip for a while to delay the ejaculation, and then you can do that repeatedly for some time and you'll be good to go. There is also these medications that treat depression. They have this off-label use, the SSRIs. They also help delay ejaculation. Sertraline, for instance, I know a lot of people that take this medication to delay ejaculation. One patient, he called me and said that the doctor has given him sertraline to delay ejaculation. But the problem he was having is that, he doesn't even have ejaculation. It takes so long for him to get ejaculation. So I told him to break the pills in half. I think the dose was too much for him. So I told him to break the pills in half. And then another time I saw him, he said it's working fine after he took half of the pill. So these medications work. They work so fine. Currently in Europe, there is one that is approved mainly for the premature ejaculation. It's called Dysfunction. Dysfunction is approved. Here in the United States, it's in phase 3 trial, so it's not approved yet, but it's going to be approved soon. And then we have this topical anesthetics. These you spray on the penis. You spray on the penis, and then it numbs the penis. So you have premature ejaculation. So you're able to have, you're able to have erection. But the problem you have is that you can't maintain the erection. So when you spray this medication on the penis, it numbs the penis. So during the stimulation, during the sexual activity, you don't feel it. You don't feel it because when the feelings become so strong, that is when you ejaculate. But this one reduces the feelings you'll be getting. It reduces the feelings you'll be getting from the sexual activity, so that by reducing the feeling, you don't ejaculate easily. So you only ejaculate when the medications start wearing off. So these are some of the treatment for premature ejaculation. Sex itself has so many benefits. Sex has so many benefits that we can talk about. So trying to maintain erection is essential. Sex can be good for your heart. The blood flow help you with your hypertension. So sex is good for your heart. It can boost your immune system. This IgA, this antibody, sex help to increase the level of this IgA that help fight infection. So sex can boost your immune system. Sex can help relieve pain. Orgasm release this hormone. As a matter of fact, during sex, there are so many hormones that are released. One of them is called endorphins. They act as a natural painkiller. So sex helps to reduce menstrual pain because of this endorphin. It helps reduce migraine. It burns calories. it burns calories. This is not to say that you can replace regular physical activities with sex. No, you have to do physical activity, but then sex helps. It can burn up to about 200 calories. Prostate and vaginal health. For men, regular ejaculation. If you have about 21 or more ejaculation a month, it helps. It helps to prevent prostate cancer. And then also for women, during sex, because of the lubrication, during sex, it helps lubricate the vaginal walls. Because of that, women with vaginal atrophy, especially with the menopausal women, a lot of them have vaginal dryness, which is called vaginal atrophy. Sex helps to lubricate the vaginal walls. It helps reduce stress and anxiety. During sex, the level of stress hormone, cortisol, lowers. There's lower level of cortisol. And then we have hormones called dopamine and serotonin. They all increases during sex. These are all happy hormones. So sex helps to reduce stress. It enhances bonding. There's this hormones also called oxytocin. It's called love hormone. It helps bonding. So regular sex can strengthen relationship. It helps you bond well with your partner. It also helps you sleep better. This hormone prolactin, it makes you feel dizzy. That is why for most people, after sex, they sleep. It's also good for your brains. It's good for your brains. Sex increases self-esteem. If somebody is walking boldly, sometimes they're having good sex at home. So sex is good. Sex is good. It strengthens relationship. It strengthens communication and relationship. It also helps with procreation, having children and everything. So this is the end of the presentation. I hope we're going to break the silence and ask more questions. If anybody has questions, this is the time. Auntie B, I'll hand it over to you.
Thank you so much, Dr. Odame. I have learned a lot from the presentation. And we are now open to questions. And one thing I'm picking from here is erectile dysfunction is a couple issue. It's like something that husband and wife have to deal with it together. And I don't know if there's any way. You mentioned about is there any, especially for us women, what we can do to help?
Yeah. Okay. So it's a couple issue, like you said. The women should actually help their partner. If you start, you have to encourage your partner to seek medical help, and also don't shame your partner. A lot of women tease their partner with it. It's not good. You have to encourage your partner and don't shame him. Don't always put pressure on your husband to get erection. No. If this is become a problem, there are so many things you can do between the two of you to enjoy the sex, to achieve orgasm. But then it becomes a problem for the two of you. Don't shame your partner and encourage your partner to seek medical help.
Well, thank you, Dr. Odame. The floor is open. If you have any question, anything that baffles you, you can ask. I know it's a very sensitive topic, but you want to kind of break the silence, see so we can talk about it.
Yeah, so yeah, you can ask general questions. It doesn't have to be your question. If something you think can be happening or can happening to somebody, you can ask.
Or you can put a question in the chat to the host.
Auntie B.
Can I have a question?
Mpacho, psychological factor, no. Sabibia, we know partner, pointing near ma. No, says we deal with it, doctor.
Oh, yes. Okay, so yeah, just, you know, you have to resolve conflict between you and your partner. Yeah, it can affect you psychologically. If sometimes, okay, some women think that their partner is not having an erection around them because their partners don't like them. You know, that is not the case. They like you, but then if there is always a conflict and then you don't resolve the conflict, if you're always fighting about things, it can actually affect erection. Yes, that is true. And if the two of you cannot resolve the conflict on your own, I think sometimes you can seek help. You know, you can talk to your pastors, you can talk to your counselors, your church elders. So yeah, sometimes it becomes necessary that you talk to a third person to resolve these conflicts in relationships.
I think, Dr. Odame, we were having a conversation where you mentioned that for when it comes to women, like the white women will pick up medication for their spouses. And for African men, they will come, and when they take their medication, they will pour it out of their medication. But I want you to share, because these are some of the things that.
Okay. So, you know,
Doctor, before you go on, I think someone has their hands up. George Spawn, go ahead and ask a question before.
Yes. Thank you. Thanks so much, Doctor. I have a question. My question is, I know of an aged man, and they have a problem when he goes to the wife. No erections. But when he goes to the younger women, she gets erections. What is the reason?
Okay. I totally understand that. Okay, so here is the thing. You know, because we are with our partners, right? We are with our partners, we get used to them, right? And then we always want to see something we haven't seen before, you know? So when you are going to see a new person, that anxiety, that your thought of thinking what that person might have that you haven't seen before alone can help you gain erection. But then it's going to happen only for that day. If your erection is caused, if your erectile dysfunction is as a result of, let's say, you have hypertension, if the hypertension is causing your your erectile dysfunction, if you have that diabetic issue that is causing your erectile dysfunction, if you have psychological issue that is causing the erectile dysfunction, the first day, even you might be fine the first day, but then after that, the problem will come back. So sometimes it is not because you are used to your partner, it's because of the underlying problem that you have, you know? So you can have a young person, but after some time that you are with this person, the problem will come back. So you have to treat the cause of the problem. Just cheating on your partner or going for another woman is not a solution to the problem. It's a temporary solution, but then you have to have permanent solution to the problem. Yes, it might work because you are seeing something you haven't seen before, but it's not gonna last. Yeah. And then Auntie B was also saying something about, okay, so in the pharmacy, the people that are from here, you know, they understand this erectile dysfunction because their men have open communication with them, you know. So the man will tell the wife about the problem they have. If you don't have open communication and then you always hide it, it becomes a problem. Like in the pharmacy, when our people, especially the African people, when they come to pick up their erectile dysfunction medicine, when they come to pick up their Viagra, their Cialis, they hide it. They open the bottle, put the pills in their wallet, and then give you back the bottle to put in the trash for them, because they want to hide and take this medication without having a discussion with their wives. They don't want to open up with their wives, you know. If you have this problem, it should be a problem for you and your wife. You shouldn't keep it to yourself, you know. So we should have open communication about it. You are not alone. A lot of people have it. About 30 million American people have it, and 50%, 1 out of 2 men between age 40 and 70 have it. So this is not something that, you know, even if you haven't told people, people still know that men go through this. So it shouldn't be something we should hide.
All right. Doctor, thank you. There's another person with their hands up. Emmanuel Boateng. Could you go ahead and unmute
Yeah,
yourself?
thank you very much. Doctor, is there help for people whose male functioning is totally dead? Like in Cree, they will say a wukojo.
Okay, so if it is totally dead, like you are saying, that means you tried the pills, it didn't work. You know, you tried the pills, it didn't work. Tried the injection, it didn't work. You know, you tried the vacuum pump, it didn't work. Then you can have the penile surgery. That one works no matter what. That one doesn't fail. It has 95% success rate. It doesn't. So that one, you have control over your erection. It's like switching off light. You know, during sexual activity, you turn it on, you press the pump, and then you have erection. After sexual activity, you go back, you press the pump, and then you lose the erection. So there is nothing like it is dead. It cannot function. Nope. It can function. It can function. And one thing I should also emphasize is that age doesn't, it is not inevitable that once you age, you have erectile dysfunction. There are a lot of old men who have strong erection. But the problem is that when you age, you have a lot of these underlying conditions, like high blood pressure, diabetes. That is why, and other, you know, conditions. That is why a lot of the time we think older people have erectile dysfunction. They have it because of these underlying conditions. But there are men who are old and their erection is fine. So what I'm saying is, we don't have something like it is really dead, nothing can be done to it. If you are in this country, you know, you can have a surgery and insurance pays for it, you know. So it is not dead. We don't have like dead like that, no.
All right, thank you very much, Doctor. Because I think this message should be preached to a lot of communities, because a lot of marriages are going down because of these issues. Thank you so much.
All right, thank you.
If you have I think we already have like 2 invitations to do this presentation. So if you have like a men's group and want to invite us to do this presentation, you can email me at boseamo@ myafridreams.org, and we'll make an arrangement to come and speak with your men's group. You know, I have learned a lot from this presentation. Doctor, I have do you see like a younger, like 20s or 30s that come for treatment? And yeah.
Oh yeah, yes. Okay, so a lot of young people take, Viagra and these other medications to help them with their erection. So yes, so this problem is not only for some age group. It affects men of all ages. One time, this young man called me and he picked up Viagra from the store, and then he called from home and said, "Hey, I've taken my Viagra. I was expecting my girlfriend to come, but my girlfriend didn't show up. But I've already taken it. What is going to happen? Am I going to be walking around with erected penis?" You know, those medications, they don't work like that. You can take the medication, but you cannot have erection. It helps you with erection during sexual activity. When you are aroused, it needs arousal to work. So even though the gentleman took the medicine, he was a young man, he took the medicine, the girlfriend didn't come, but she'll be fine. Had it been the injection, once you inject it and your partner doesn't come, you'll be walking around with erected penis at least for about an hour.
Yeah, I know.
But yeah, that one works right away.
That's right.
Doesn't need arousal to work.
Oh my God.
Yeah. Yeah. If
There is no more questions. I don't see anyone with their hands on
Yeah, I have a
their
question.
hands up. Oh, okay.
Yeah, so Doug, thank you so much for the presentation. So you had mentioned in cases like this, sometimes it could be there's like an underlying issue,
yes,
which is causing some of these things. So how do you start a conversation with your doctor? Because sometimes, I mean, some doctors, I'll put it loosely, are lazy. They wouldn't do what they need to do, and they'll just give you a prescription or go try this. And they are not getting to the root cause of what the problem is. So how do you start a conversation with the doctor to get to the root cause, to know exactly what is going on?
Okay, so for somebody who doesn't visit their doctor regularly, for somebody who even don't go to the hospital, let's say you are in a lot of Ghanaian men, don't have this regular, it's like we do here. So let's say you have an erectile dysfunction, and then you go to the doctor and then you say, "Doctor, this is my problem. I cannot have erection." Your doctor, that one, it's not, your doctor cannot even diagnose you the same day, because your doctor has to check you for all these possible health issues that can make you have problem with erection. You have to be tested for high blood pressure. You have to be tested for diabetes. Your psychology has to be tested. Your wife has to be talked to and see if you have a problem at home. So it is not an easy diagnosis. It is not something that sometimes you have to be involved with a team of doctors. But then if, let's say, you are a regular patient to this doctor, if your doctor knows your medical history, your doctor knows that you have diabetes, you have hypertension, you are on this type of medication, your doctor can assess your medical record, can check what medication you are taking. Is it this person is having this? Your doctor can ask you, when did you have the erectile dysfunction? Is it after you took this medication? And if it is the medicine, he might change the medicine for you. If he thinks you have it because you have uncontrolled diabetes, maybe you haven't been taking your medicine. So there will be a series of questions your doctor will ask you. Sometimes it can be embarrassing, but it's okay, you have to go through that. So yes, you know, your doctor will ask you a lot of questions before the diagnosis. One thing, last time I was, okay, let me make clear. Some people think that erectile dysfunction sometimes is a result of spiritual issue. I was listening to this TV program in Ghana, and then the gentleman said that he went to see a spiritualist, a female spiritualist. And then it ended up that they slept together. He slept together with the female spiritualist. So after that, when he came home, he's not able to have erection around his wife. So he is thinking that the female specialist probably might have done something to him. That is why he's not having erection around the wife, you know? And then he brought it on this television, this, you know, a lot of these Kumasi TV stations that talks about these marital problems. And they called the spiritualists and they were having a discussion about, you know, this person is having erectile dysfunction, not because he slept with the spiritualist, no, but probably he's having a psychological issue that I've gone to sleep with this woman. It's likely that this woman will do something to me, so I cannot have erection. So every time you have this idea in your head, so that thing will be bothering you. So that psychological issue alone can, you know, affect you, and then you will not have erection. So there's no, erectile dysfunction is not a spiritual thing. It is a medical condition that need to be treated.
So, doctor, we have two people that has their hands up, but we went over time. So I'm just gonna can you unmute yourself and ask a question, please?
Yes, hello. So my question is, I know some people who are very young, they still go ahead and take these aphrodisiac or sexual enhancing drugs just to boost their ego or just to make impression. So my question is, if somebody is taking this medication not because of medical situation that is necessitating it, but the person goes ahead and use it, is it going to create some kind of dependence? And also in the long term, is it going to have any like consequences for the person who actually shouldn't have taken it, but just to create that sexual impression? I don't know if my question is clear.
Yeah, I understand your question. You know, so it looks like a lot of men, for whatever reason, they think that having that long extended sex means the woman will think you are man enough, like you are strong. And most men also watch pornographic, and then they think that sex is actually what they see in porn. It's not like that. Sex is a playful thing that, you know, you don't need too much to please your partner. You know, there's so much you can do to achieve orgasm. So don't get dependent on these medications if you are not a candidate for that. And your doctor will not give you the medicine if he thinks you don't need it. You know, the doctor doesn't give you, but I think most people, for whatever reason, are able to purchase these medications online and use it. Don't get dependent on the medicine. As to whether you can be dependent on the medicine, as a matter of fact, if you don't have underlying condition, if blood is flowing well in your body, you know, you wouldn't be dependent on this medicine. People don't get addicted to these medications. You can take the medication initially if you if you're having that erectile dysfunction, if you haven't, but then once you start exercising, once you start taking control of your health, once you start taking your diabetic medicine, your blood pressure medicine, and then you become okay, sometimes you can stop taking the medicine and then you'll be fine.
Yeah.
You know, it's not medication you can be addicted on. No, people don't get addicted to erectile dysfunction. So yeah, I see young people using it to just please their partners, but then, you know, young people will be young people, but once they stop, they will be okay. You know, they wouldn't be dependent on it. No.
I had my supervisor on, Olivia, but I don't know whether she left. She had her hand up. Yeah.
Hi, good evening. Yes, I'm still here. Thank you so much for this educative and information that you've given to us tonight. I had two questions, but my second question was asked by the person in front of me. My question was that if a person is taking all this medication, would they be able to father children?
Oh, okay. Yeah. Okay. So these medications don't have effect on the sperm. You know, I like the question. It's a good question. These medications, they don't affect the quality of the sperm. It is only to help the blood vessels that supply blood to your penis get dilated. It only helps to open these blood vessels so that the blood can flow through the penis. But then it doesn't have effect on the quality of the sperm that you need to, you know, become pregnant. So yes, it will not have effect on the sperm. So it will not affect procreation. You know.
All right. Thank you.
Oh, thank you. Thank you all so much. Thank you. I think I have learned a lot, and I know you have all learned so much from this presentation. And I chose today, February 11th, close to Valentine's Day. So we chose 11th, and Valentine's Day is the 14th. So we are wishing everybody happy Valentine. And we are praying that things will get better, and we are going to take action. Please, when you visit your doctors, start talking about this issue. You need to start a conversation with your doctor. Some doctors might not ask you, but as soon as you mention it, they are going to take care of it. And so once again, I want to thank all of you for coming, and I also invite you all to go to our website and please donate so we can continue to serve you. Thank you so much. God bless you all for coming. Next month, we have a back injury, and we are all invited to join us. Thank you so much. God bless you all. Thank you, Dr. Odame. Thank you so much.
Thank you, Auntie V. Thanks.
Good night,
Recording
everybody.
stopped.